Hi, everyone. I'm extremely excited to be speaking with Dr. Emily Gutierrez today. Dr. Emily Gutierrez is the Chief Scientific Medical Liaison and Formulator for Neuronutrients and has over a decade of clinical experience managing patients in her busy practice with Neuronutrition Associates, one of the first pediatric-focused functional medicine practices opened in the United States. Dr. Gutierrez received her doctorate from Johns Hopkins University with a focus in translational medicine as a doctor of nursing practice. She received her master's degree from the University of Texas at Austin and is board certified as a pediatric nurse practitioner. Dr. Gutierrez is also board certified through the Institute for Functional Medicine, board certified as a clinical nutritionist, and board certified as a primary care mental health specialist. In addition to actively managing patients in her private practice in Austin, Texas, she's also adjunct faculty at Johns Hopkins University, where she lectures on integrative and functional medicine. Dr. Gutierrez has published in peer-reviewed literature multiple times. However, one of her favorite accomplishments was publishing the first chapter on integrative and functional medicine in a textbook for primary care providers. Dr. Gutierrez continues to be an active researcher, writer, speaker, and her passion for formulating science-based nutrient compounds that meet the strictest standards of quality and efficacy continue to be her favorite tool in managing patients. So, Emily, welcome to this show, and thank you so much for taking the time to speak with me.
Oh, well, thank you, and thank you for that introduction.
So we are talking today about autism spectrum disorder, and this is an area that you specialize in. It's an area that is very close to my heart because I have a close family member that suffers from autism as well. And I'm sure the people listening to this can all relate because we now all pretty much know someone that suffers from autism spectrum disorder. So I want to just start by asking you a little bit about your journey into functional medicine and ending up with this patient population and treating them.
That's a good question. I think anyone that starts to really study integrative medicine will end up knowing functional medicine. And it started for me because I started out in primary care in Austin, Texas, where, my patients were very, I won't say anti-medicine, but there's a lot of what can we do besides prescribing medications? What vitamins can we use? What botanicals or essential oils can we use? And I felt woefully underprepared to really serve my population. They wanted a different type of healthcare, and I was their healthcare provider. So that was my problem. I wasn't taught about it. So at Hopkins, that was my journey, is figuring out how can we as allopathic mainstream providers integrate some integrative care into our practices and do it that is based on science and do it safely and know, how to incorporate that into our practice. So at Hopkins, that was my problem. I didn't know how to meet my patients where they were at. So my journey was discovering how to do that. I did a clinical trial around that, and we showed some success. And because I'm a very curious person, and the more I study about integrative medicine, the more it just fuels your fire and you want to learn more and more. So, instead of just staying integrative, I took a deeper dive into functional. And the difference is integrative is what else can you do for this condition? So if you have a runny nose, it's in allopathic care, it's just basically, do some over-the-counter decongestants and give it some time and it should resolve. In integrative care, it's more of, what else can cure the runny nose? Like, can we use xylitol or, can we use sauna, or what other integrative practice can you put on it? And functional is, well, why do you constantly have a runny nose? So it's the question why. And with acute medicine, that doesn't always work, right? It's pretty straightforward when you have strep throat. Well, maybe strep isn't the best example because of pandas, but with flu, it's pretty straightforward most of the time. But with chronic illnesses, the why is really important because sometimes the allopathic paradigm of care doesn't work, nor does the integrative.
Right. And that's so fascinating because that's basically along the lines of my journey where I was in that allopathic framework, primarily in the hospital, and seeing a lot of patients come in with chronic disease and just realizing that we may be well equipped to handle their acute issues, but not so well equipped to handle their chronic issues. And we just didn't have a good way of doing that in the hospital. And that's what pretty much led me to starting this practice and trying to really integrate the best of both worlds, using allopathic medicine, but also seeing what else we can use, because these patients really need better solutions and we just didn't have that, or I wasn't exposed to that early on. And so it's great that we have that similar pathways of getting there. You wrote a book on autism, which I have right behind me. It's called The Parent's Roadmap to Autism. And it's a book that's really helped me in understanding this condition. And so I want to start by just mentioning that autism is becoming more and more prevalent now. You mentioned in your book about 1 in 36 roughly school-aged kids, and that was probably in 2017 or 18. I don't know if that's changed. More likely that those rates have gone up. But we are basically over the last several decades seeing an increase in the rates of autism. So I want to ask you first what your thoughts are, more from a bird's eye view, as to why that might be happening and why are we seeing more autism out there?
There's a lot of hypothesis why. One of the big hypotheses is, we're just better at identifying what autism is. And I think to some regard, there might be some truth in that, but I really don't think it's all of the truth. To me, dealing with this population and treating these families over time, these kids come to me with a lot of oxidative stress in their body. Mm-hmm. And oxidative stress means there's a lot of free radicals, a lot of kind of interior rusting, a lot of stress on the systems that need balancing. And they have stress for a variety of reasons. Mm-hmm. So I think as our world becomes more toxic and our environment becomes more toxic, our children are becoming more toxic, and you're more likely to need to really pay attention to their wellness in a different way from a very, very early age.
So a lot of it comes basically back down to the changes in our modern way of living. A lot of it is dietary based, the toxins around us, the stress that we face, and now more so younger kids face. So I think a lot of that is what is to do with these increasing rates, certainly. And so, this book is very interesting because it very clearly lays out how autism is treated currently in the conventional system. And when we look at it from that perspective, it's more of a psychological condition. And that's basically how it's looked and treated now. So you're most likely, if you get this diagnosis, you're going to be seeing a neurologist, a psychiatrist, and any other specialist in this field after you see your pediatrician. So what are your thoughts on you mentioned more of a biomedical, or more of looking at it as a medical disorder. So can you speak to that a little bit? What is the shift in thought process of autism being seen not so much as a neuropsychological disorder, but a whole body medical disorder?
Yeah, that's a really good question. And, the allopathic paradigm, or the mainstream narrative, still is, they do have neuropsychiatric symptoms. So right. You will have things like, OCD type behaviors, stimming, scripting, where, they might have speech, but they're going over a script in their head and it's kind of nonsensical. Or you can have apraxia, where they don't talk at all. Some kids meet their milestones and have a severe regression. Others are delayed from the very beginning. That's the diagnostic criteria now, is do you have these set of symptoms that are neuropsychological? But where the paradigm shift comes in, and I'm excited because I think it's happening around depression now as well, is depression used to be this monoamine hypothesis, right? It's all about serotonin.
Right.
And what we're coming to find out is serotonin plays a role, but it's not everything. Your gut, your inflammation, your environment, your genetics, your methylation. And it's the same thing with autism. It's typically not one gene and one thing. It's a variety of things causing dysfunction in gene expression. And I don't know, are you familiar with Dr. Richard Fry's work?
I haven't heard of him, no, but I will look him up, certainly.
He's a really wonderful autism doctor, and I follow a lot of his work because I like the framework he puts around why are we having so much autism, and as a provider, how can you look at it in the biomedical or kind of from a physical sense? And he breaks it down into 4 parts. Part of it, maybe 20% is genetic, and there are strong genes. There's chromosomal genes, there's Mendelian genes, where if you have this, you are going to have the expression of something. Then there's also genes, maybe we can talk about a little bit later, that they're really like, epigenetics and the expression of them are super important. So there's a genetic component. And then those other 3 components are, oxidative stress or redox stress. So when the body is super stressed out from, a variety of things, infections, toxins, etc. Mitochondrial stress, which really goes hand in hand with oxidative stress, right? Because the more oxidative stress you have, the more it's going to lead to poor autophagy, more mitochondrial stress, etc. And then the last one is poor methylation. And that could mean from just not being able to break down some of your B vitamins to you're building antibodies that are preventing those good methylated active forms of folate getting into the nervous system and crossing through the blood-brain barrier. So it's, when you look at a child through the biomedical sense, my first question is, where's the fire? Where's the fire, and where do we start first in trying to put out, the thing where the fire's hottest. And often it's just not, they have, dysbiosis, or their gut is not balanced and they have, some gram-negative bacteria in there, and they have, irritable bowels. It's usually a combination of a lot of different things when you really do a systems evaluation.
So I think that that really speaks well to how the current way that it's dealt with falls short. So again, that sort of psychological framing of this condition, if we don't ask the questions why it's happening and what are the associated systems-related issues going on, and we sort of cut it off at the neck where it's above the neck versus below the neck, then the treatment really comes down to either psychotropic medications or other medications, pharmacologics, and behavior therapy. And perhaps in the conventional world, that's mainly what people have received and not have much more than that. And so you have seen firsthand so many more parents coming to you desperate for more answers, more solutions, and a different approach. And so, like you mentioned, Dr. Fry, I think his work in asking that question, why? One, it's, I think, just an interesting question from a sociological aspect, where you're just trying to understand these trends in society and why these rates are increasing, but also for providers like us who are dealing with these patients and children coming into our doors. What are the better ways? And the better ways comes from first understanding what is causing the issues. So I think that speaks really well to looking at the body as a whole and trying to give these autism spectrum patients a little bit of a different paradigm with which they can, get their care. So I want to ask you, so one thing is, you mentioned in the book that it's a roadmap that you laid out, which is that no two patients, no two children start at the same place. And I think that that is a great point, that patients are unique, and each person should have an individualized approach to their care.
Absolutely.
So, like you mentioned, when you treat one kid with autism, you've treated one child with autism, and that it really just humbles you. Where if you apply the exact same things to two different children, you're not going to potentially get the same results, and that's why such a personalized approach is needed. So I wanted to dig into that very approach and understand what it is that when you're looking at a patient, when you're looking at a child coming in, how are you seeing them, and what are the first couple of questions that you're asking them in order to give them this more biomedical approach?
Well, first, I think we have to acknowledge the providers that are treating autism that don't know integrative and functional medicine. And I know they're doing the best that they can. And I really don't want to villainize medicines at all. When I first got into functional medicine and starting integrative medicine, I thought, I am never going to prescribe another antibiotic ever again in my whole life. Right. And that's just absolutely ridiculous. Sometimes antibiotics are needed. Yeah. And it's the same thing with psychotropic medications. I mean, if you have an aggressive child on the spectrum that isn't sleeping, that attacks his teachers, that headbangs, I mean, maybe, a dose of risperidol or an antipsychotic is something that child could benefit from. Yeah. Now, even if somebody comes to me on medication, I don't want to try to keep them on that medication forever, but maybe that kid that's headbanging has terrible gut pain, but nobody's looked at inflammation in his gut before, So when parents come to me on medication, I always think, okay, how can we minimize this medication list? And then how can we work into for the underlying factors to try to solve those, that maybe one day we can get off this list of medications, reduce them, or maybe even get off them completely. But there is sometimes that parents need some symptomatic help, because otherwise they're going to have to put their child in a home, or everyone is so stressed that medications can be helpful. But when I first see a child, I mean, I don't know if you learned in medical school, probably so, that 90% of the diagnosis is in the history. And over time, the history is so important. And when you're seeing the pediatrician and you have 15 minutes only, it's just the model of care. You can't sit down and say, let's talk about preconception and what happened right after birth and what was that first year of life like, and, what have you done with food and vaccines, and was there any injury to, any major hospitalizations or illnesses, and when did the autism come on? I think in the history, one of the things that really piques my curiosity is if there was autism from the beginning, or there was a regressive form of autism. And the forms of regressive autism tend to be easier to reverse. And, when I hear a history of my child that was delayed from the very beginning, it's even more important to me that they have that big genetic chromosomal microarray and Fragile X done. Okay. Because I think that's really, really important. Most kids have a regressive form of autism. Not all of them are autistic from the beginning, or a large majority of them have a regressive form. Right. And what do you mean when you say regressive form? Yeah, it means that, say their child was 18 months and they were walking and they were talking and they were doing really well. And then they had an event that caused a lot of inflammation, and then they stopped talking. And they regress with their milestones. So they're kind of on that trajectory, and then it stops, and then they reverse. They lose milestones. Okay, versus they never got to the milestones in the first place. Exactly. So first thing when a kid comes in and also has apraxia or isn't speaking, I mean, it's really foundational to make sure that kid's had a hearing test. But also if I hear the history of, we've had chronic otitis media or ear infections, and he's been on 15 antibiotics, I think, oh, wow, what's the hearing like? And man, what's the microbiome like? You know, I really, really try to never, ever, ever prescribe antibiotics in the first year of life. It really is, your microbiome it's settling in, it's developing. And, you know, the catch-22 to that is most infants have the worst microbiomes. Have you ever done a stool study on a less than a 1-year-old?
I've never seen a less than 1-year-old as a patient, which is probably a good thing.
Well, it's interesting. And I, you know, at first it was kind of striking, like, wow, I mean, this must be really unusual, but it's not. I could do a retrospective chart review and show you. But man, infants have really interesting bacteria. When you look, if you're colicky, if you're fussy, if you have eczema, boy, that infant needs a stool study, and you will find a lot of dysbiosis.
Okay.
So you add that with, you know, taking away the good flora by antibiotics, which, you know, if you have a 15-day-old that has a fever without a source, they're going to go in and tap their spine and give them IV antibiotics. And I don't know that you shouldn't say yes to that. I don't know that. It would be patient specific. And what if they had a bacterial meningitis and you didn't give them antibiotics?
Yeah, that can be deadly.
Yeah, exactly. So I just got off on a tangent. So I think you were asking me about the workup functionally when I have a new patient. Is that correct?
Right, absolutely. And I think, you know, you're speaking to all the right points in that, you know, the antibiotic use early on, dysbiosis, which is an imbalance in our gut bacteria, the good and the bad bacteria. And so a lot of these kids with autism are presenting with certainly neuropsychological symptoms, but also have sometimes hidden but sometimes evident GI symptoms that go unnoticed, maybe because whoever's seeing them isn't really trained in that or doesn't have that awareness of the connection between the two, or skin conditions like eczema, like you mentioned. And so to be able to put all that together is really the key to treating that patient well. So absolutely agree there. Now, you mentioned in the book, go ahead if you had something you were going to say. Well,
and there's some low-hanging fruit with a lot of children in general, autism or not autism. And, you know, if you are trying to find the sources of inflammatory stress, the two biggest low-hanging fruit is what are they eating and what is their gut like. So when someone comes in and I do assessment, I'm thinking insistence. I'm not just thinking about, you know, their brain and their neurochemicals and their glutaminergic load versus how much GABA and serotonin they have. I'm also thinking about, you know, what's the balance of their gut? Do they have inflammation? Are they detoxing? Are they stooling every day? Are they sweating? Are they moving? What inflammatory things are mediating and propelling the symptoms? Like if they're allergic to eggs and they're eating them every day.
Right.
So food and gut are probably the two really foundational things to look at first. And, you know, pediatricians can do that. Families that don't see somebody functional can do that. You can, you know, especially if your child has eczema. To me, eczema, 95% of my patients can be cured if you fix their food and if you fix their gut. And by fixing their food is really identifying, well, what are the foods that are causing inflammation? And there's two types of foods, as you know, and it gets kind of confusing for parents. And I've actually seen this a lot in clinic lately. Is, you know, we'll have somebody that has done a food study, and they're like, "Oh no, I've already done that before. We don't need to get that blood work." But the difference between what's sensitive in a food and what's truly allergic is very different, right? IgE versus IgG allergies. And I think true allergy and sensitivity is important to get on a child, especially if they have skin manifestations. But the catch is, if somebody comes up with a lot of IgG or sensitivities, you know that there's a permeability issue in their gut. So, you know, as you know, how to fix the gut is part of it's making sure that what you're putting into your gut isn't irritating it. And the second part is trying to rebalance it, taking out the flora or the bacteria or the parasites or the fungi that shouldn't be there and replacing it with the good fiber, insoluble, soluble fiber, prebiotic fiber, and getting all those good colonies to grow, but not to overgrow, because then you can create other problems.
It's all a balance. Yeah.
Yes, exactly.
Yeah. So you spoke right now I think 2 of the 5 things that you mention as the core areas that you focus on when you see a patient, the 5 being nutrition, gut health, toxins, immunity, and which one did I miss? Genes, right? So so you spoke to nutrition and gut health. And so what about the other 3 of these where it comes to genetic testing and when it comes to immunity? I'd certainly like to hear your thoughts on that when let's say you've dealt with a lot of the basic nutritional side of things.
Mm-hmm. I think that, really making sure you have a solid foundation first is important. And, toxicity is nuanced. It's not the same in everyone. And there's not just one way to evaluate toxicity. So toxicity to a pediatrician is they're going to do a lead level and they're going to see if there's lead in the blood. And that's really standard of care. At 9 months, you should have a lead level done on your baby. Right. So, what's curious to me is that not all pediatricians for sure, but most pediatricians, if you get a 2 or a 3 back in your blood, they're like, oh, it's within normal limits. It's totally fine. But I'm like, oh no, you're being exposed to lead. We got to figure out the source and we got to get it out of your body. Because in some people, based on their genetics more than others, they don't biotransform that toxin or that heavy metal and they store it. So I like to know, what are you being exposed to now and what has been stored? So I know chelation can be kind of a dirty word and a scary word and really turn some people off. But the truth is if you do an assessment on toxins, so let's say heavy metals in particular, and you look, you're going to find what's being in that child's, environment within the last 6 to 12 weeks. So you might pick up arsenic, especially if somebody's eating a lot of rice. You'd be so surprised how much arsenic I find. Oh yeah. And you can even just do a urine heavy metal panel from CPL and it gives you arsenic, cadmium, lead. It also gives you a zinc level. So you can find a lot of things in the urine, but if it's current, we need to do a big assessment on the environment and figure it out. Right. But when it's not properly detoxified, it can be stored. And it's stored in your adipose tissue and in your bones. And so in order to figure out what's kind of your net retention of those heavy metals, I like to give a small dose of DMSA, and it's called provoking a urine. So then you get a child to provoke a urine and you see what's stored. And can I tell you an example of something that's really fun that I found lately? Yeah. Well, fun might not be the best description for it, but
interesting maybe. Yeah.
Interesting. So I have a non-autistic 4-year-old now that I've been working with, and she has had chronic lead in her blood over and over again. And it's never high. And believe me, these parents are like the best parents. Like they are so mindful of everything in her environment. Her nutrition is beautiful. Like everything is going right for this little girl. Right. She's not growing. She's under the 5th percentile, or she's not even on the curve. Not growing. So in the past 6 months, I encourage the parents. I'm like, DMSA is FDA approved for lead toxicity. It's really safe. Right. We dose it based on, milligrams per kilo of the weight of the child. I usually do 30 and then max out at 100, 800 milligrams it is for a provoked dose. So we did a small dose and she has the worst lead toxicity ever. Wow. Like it is just off the charts. And we're working on getting the lead out. We're working on it. And that's important for her. She doesn't have autism, but she's not growing. So my hope is we, detox her from her heavy metal toxicity and she grows better. And that will be a win for us. But in autism, with that redox stress, with, there is, it's connected, right? So there are some genes in autism that you don't make cysteine well, your CTH gene. There's also some you don't make your glutathione very well. And these are antioxidants that when your body is trying to mobilize these toxins, it needs that antioxidant to bind them so you can biotransform them. You can poop them, pee them, and sweat them out of your body. Right. So it ties a little bit into genetics. And I also think that toxicity ties into redox stress and mitochondrial stress. There was a really interesting article that was recently written in January of 2022. Let me see, it was by, I'm gonna butcher the last name. So it's Trifonova, and the title of it is Abnormal mTOR Activity in the Pediatric Autoimmune Neuropsychiatric Associated Autism Spectrum Disorder. And I know that's a mouthful. That is a mouthful, but in October, I'm going to go speak to the parents at TACA. So it's used to be called Talk About Curing Autism, and now it's the Autism Community in Action. And I'm going to speak on PANS and PANDAS. So an autoimmune encephalitis.
Can you just mention to people what PANS and PANDAS is, who may not know?
Yeah, so PANDAS is pediatric autoimmune neuropsychiatric disorder related to streptococcus. Okay. And basically what that means is sometimes a child gets a strep infection and it usually is occult, meaning they have it, but they don't have big red tonsils, fever, rash, malaise. They just are carrying around strep. And as it goes undetected, it causes some immune system dysregulation. Right. And you start having parts of your brain attacked by your immune system, and it causes this constellation of symptoms like OCD, anxiety, separation anxiety, bedwetting or regression, and like being able to stay night trained or urinary symptoms. There is a lot of OCD that goes with it too. And it's usually very abrupt that it comes on. So unfortunately, autistic kids are more vulnerable to develop PANS. And in this article, it was trying to elucidate that and talk about why is there an association. And I think it goes back down to those things we were talking about of redox stress. And stress on the person will cause stress in the mitochondria. And when you have a lot of stress in the mitochondria, all of those little organelles and systems within the cell should be like little machinery factories to clean up things, take out things, produce energy. And it's like when you have a problem doing that, the oxidative stress builds in the body. So that process is called autophagy. And it relates to mitochondrial stress and autism.
Yeah, that's so fascinating.
That's another part. It's a great article. Maybe I should give you the.
Yeah, I can.
Put it in your,
I
in
can
your
link.
note.
Yeah, absolutely. So I'll do that. And I think the other one you mentioned immunity briefly. I just wanted to mention and see your thoughts on. There's research that I've seen that points to sometimes an autoimmune basis to autism, right? And that is where sometimes maternal. Let's say autoimmunity and the development of antibodies in the maternal system can transfer across the placenta to the baby and basically affect the baby's immune system, and that can potentially, and that's been linked with the development of autism in the next few years for that child. So can you speak to that, and is there validity to that theory?
I think it's a really interesting theory, and it's something to pay attention to. I still don't think it's the only thing. I think you have to have a vulnerable host for that to happen too, right?
Genetic predisposition.
Yeah, absolutely. I want to be careful not to blame mothers though, because it's it's so hard. I can't tell you how many moms I've sat knee to knee with, and they just go back and they're like, if I only wouldn't have vaccinated, if I only would have, done a detox before pregnancy. They just blame themselves. And the truth is there's no blame. The mom didn't do anything. The mom didn't do anything to cause the autism.
Absolutely. Yeah.
So I think that doing, when women are childbearing age and they are planning, and if they can plan, I think it's so important for them to do a preconception planning on themselves and look for chronic infections, look to see what their inflammation is, get their inflammation low, get their immune systems, working as best as they can.
Right.
Because you can pass infections to your child. I mean, we see that with cytomegalovirus virus. We see that with Lyme. I mean, it is plausible.
Right. That's a very important point. And just to stress on that, because we're talking about it, again, from a very scientific and a medical perspective, but there is this real life, real world emotional component and social component to this. And so, yes, just to be clear, exactly what you said is that no mother is responsible for this or has caused this, but it's just an interesting theory or interesting hypothesis to see that is there any scientific basis to that. So I definitely think it's very important what you mentioned.
Well, and we can't not explore something because it might hurt someone's feelings. But I think that as being their provider and being somebody that's partnering with them, it's just important to say it out loud when you know they're thinking it, and have that human moment with them where you're like, I'm going to say words that you don't know. We're going to talk about redox and glutathione and detox. And, sometimes, I mean, that's the art in this. You have to be really careful not to overwhelm somebody, because then they have a hard time starting with even just one thing,
and connect with them as well.
But it's so many people studying the why. And I don't ever know if we're going to find the single agent or the single answer why. Maybe that brings us to our genetic discussion, because there are genes that are associated with autism, and some of those genes are, there's actionable items that if you can identify those genes, you can actually do something about them. Like, for example, in some kids, they have something called a shank mutation. And that is really an impaired development of their glutamate receptors in their brain. And recently, I've had a couple of kids that I'm running a genetic panel on. Would you like me to say who I'm running panels with?
Yeah, absolutely. Yeah.
So I have been using Dr. Sharon Hausman-Cohen's genetic test called Intellix DNA. And she's a firecracker. She is a Harvard doc that is just super, super smart. And she started doing a lot of work with Del Bredesen in the neurodegenerative space. Right. And about 3 years ago, she really embraced the autism field. And we've been putting together panels for autism. And I've been part of her beta users. And she has some of the smartest physicians in the world working with her on autism. So there's an autism and mental wellness panel that I run, and it gives me clues, The reason I like this test is because of looking at like what's common in the population. So there are some that are common in the population that are also important, like especially when it comes to methylation. You have to have B12 and folate to methylate. But the catch to that is you have to methylate your folate into that type of folate that's needed for methylation, right? Yeah. And that's super common. It's super common. When Ben Lynch came out with MTHFR.net, we were all excited, like, oh my gosh, I have that MTHFR gene, and I still have patients today, like really excited about their, MTHFR. I'm like, it's great that we know that, but it's one in multiple genes in that pathway. Yeah. And we have to, so when you run, do you run folic acids on patients?
Yes, I do folic acid. Mm-hmm.
You do. And I run it to make sure. So it's tricky, right? Because when it's low, you know that they are megablastic anemic. They are so deficient, right?
Right.
But when it's high, it doesn't necessarily mean that it's high. It means it's not being methylated or broken down, because that's synthetic and you need those broken down forms. So that's really common in the population. That's common for a lot of neuropsychiatric things. Instead of, you might not have a Prozac deficiency, you might have a methylfolate deficiency.
Yeah.
And that's part of autism too.
Absolutely.
But there are some genes in the intellex that are way more rare. And so I like kind of shifting and looking at it that way. Like, okay, well, like the CBS genes, it's pretty common in the population, but those people are not autistic, not all of them. But it is a gene in autism that you'll see more often. You'll see, in the Schenck population, you're not always autistic, but you're very likely to be autistic. I think, I don't want to say a number because I don't want Sharon to be upset with me if I get it wrong, but it's way more rare.
Right.
But what's beautiful about finding a Schenck mutation is, in order for those synapses to develop more appropriately, they need very high doses of zinc. So instead of giving like a 4-year-old, 20 milligrams of zinc, I might give them 75 milligrams of zinc, above what the RDA is, or even the National Institute of Health Office for Dietary Supplements upper tolerable limit of zinc, because I know that that's going to treat that child's, synaptic malfunction based on their Schenck genes.
Yeah.
So it gives you, well, and it gives you something to do. You're like, oh, well, here's an intervention that should really work over time.
Yeah.
And I've had I've had some success stories with Schenck kids.
Yeah. And I think that's, you mentioned just when you run these genetic panels, because they're very extensive tests, they're oftentimes very expensive tests as well. And so, having good actionable steps at the end of it is also very important, rather than just knowing the genetic makeup or the genes that caused it. So, it's good that we can put those together. So, and
you're right, genetics can be expensive, especially if they're quality genetics. They're checked, they're verified, they're using the right, next gen sequencing. When 23andMe came out, we were all super excited about, wow, look at all this raw data that we have, and we can file it through all of these things. But those aren't verified genes, and there are mistakes in those. So I'm going to say something that might be a little sensational, but I think if you have a child on the spectrum, instead of saving for their college when they're young, you need to save for their medical care. And you need to have that investment up front with them so that later on there's less of a cost. And it's super, super true, this statement: the earlier the intervention, the better the outcome.
I think that's very important to mention, because I think that one way or the other, whether you're doing the initial stuff like you mentioned and the genetic testing and all of that, it will still be a lot of money spent if you don't do those things and go towards the therapies like, psychiatry, behavior therapy, all of those things that come with it. So probably one way or the other, there's a high cost involved in this condition, as is the case with most chronic conditions. But in this way, you could potentially get more benefit early on. So it's very important that you mentioned that. So,
and Omar, there is a high cost associated with autism, period, because of all the therapies, the doctor's visits, the care, all of it, very, very high cost to the parents. Yeah. But my hope is that the way that we treat autism in the allopathic mainstream community starts to change. And there are some very, very basic things that pediatricians can do to lower inflammatory stress in these kids. And I know some pediatricians that are doing it. And they just need or primary care providers, nurse practitioners, physician's assistants. You just need, even just a few things can make such a big impact. But there's
especially
just more
early
access.
On. Yeah.
Oh, 100%, especially early on.
Yeah. So that awareness, and that's, a big reason to be having these conversations, is to create that awareness and to get that different model out there, that different paradigm that we're trying to look at this condition with. So I appreciate you doing what you're doing and also creating awareness about this condition. So if I could, I want to summarize kind of what we talked just very briefly, and then I'd love to hear if you have a case that is kind of stuck out for you, that is showing that how this model works in real practical ways. I'd love to hear that. And so, we're talking about autism spectrum disorder, and we were talking about looking at it away from a psychological or neuropsychological model, more towards a biomedical or medical disorder. And and your approach is taking those 5 core areas of nutrition, gut health, genes, toxins, and immunity, and to evaluate all those in a very individualized and personalized way, because you have the time to do that with the parents, but also having that awareness and using a systems-based approach, which is looking at your skin in relation to your gut in relation to your brain, all of those things together. And so that is kind of what we're talking about. That's what we're advocating for. And that's really what parents of these kids suffering with autism spectrum disorder really need. So that's kind of in summary. If I've left something out, please let me know. But I'd love to hear about a case example that you have where this model has been applied very successfully. I'm sure you have many.
Sure. Well, I'll think of some of my most recent cases, but who knew that taking dairy out of a kid's diet could improve their autism?
Right.
It sounds so simple, right? But if you're allergic or sensitive to dairy and it's causing inflammatory stress in your gut, it's wrecking your skin, it's causing folate receptors to have this antibody response to them. Mm-hmm. It just seems so simple. And it's one thing that doesn't cost anything other than, find another source of calcium, which in your diet, calcium is abundant. It's one of our most abundant minerals we have in our food source. So it's trying to put into context that the systems in our body affect the way that our brain is functioning and our body is developing as a small child. Mm-hmm. So one of my new favorite cases that, I don't know, sometimes when they send me portal messages and they're just as positive as they are, I copy and paste the message and send it to my staff to say, what we're doing is, really helpful and impactful and gives everybody a boost. But I have a 3-year-old that lives on a golf course in the Houston area. And this little kiddo came to me, was probably diagnosed. I think they were on the wait list for 6 months before they saw me, or too long. I wish I would have seen him sooner. But, the big thing after doing a systems evaluation for this kid is just toxins. Mm-hmm. And it's real interesting because, the kiddo's going outside and playing in the yard on the golf course that has all the pesticides on it. Mm-hmm. So the child had pretty severe eczema, wasn't sleeping, wasn't talking, lots of stimming behavior. So irritability, and parents are, they're well-to-do parents. They're very involved. It's their only child. They're really mindful about nutrition. And it was a shock, it was a shock on what kind of, after our evaluation, where the kiddo was at. Yeah. And so we slowly started to remove, and that's the work. What do we remove from the child that's there stressing them out? Mm-hmm. And then what do we replace to help them grow and get back on the right path to recovery? And we've done that. And, the mom sent me a portal message a couple of weeks ago saying that, I don't think that he has any more signs of autism. We're in such a good spot right now. I had to send you an email, like his new teachers are, we're getting great glowing reports. He's sleeping well. His eye contact's better. His stimming behaviors are down. His irritability is down. His skin is better.
Yeah.
So it was helpful. It was encouraging, but I don't want to leave with like, oh, and now they're on their way, because there will be a time where he gets strep throat or he gets sick or, they do something and it's like, it's not this, you hit the ground running and you all you see is improvements until, they're 18. There is this, 5 steps up, 2 steps down, 5 steps up, 2 steps down. So you will have these kind of wax and wane of symptoms, but overall the trajectory should be, I'm getting better and better. Overall all the time.
And the same applies to adults with various chronic issues, whether it's autoimmunity or something else. You'll have improvements and then you'll have, it's just the nature of the illness. And so that's such a fascinating example of a case, and it shows when it is in a practice, this biomedical approach is in practice and this paradigm is applied, how much significant benefit we can see in these kids. And so I appreciate you sharing that with us.
Yeah, well, I'm often discouraged and dismayed when I am in a group of parents of autism for various reasons, a movie showing, a special feature, etc. And someone mentions this biomedical approach and the majority of people have no idea. Yeah. And that's so heartbreaking to me because there are things that you can do early on. There are things and actionable steps that parents can make at home, and it's not all very, very, very complicated. Right. It's about removing inflammatory stress and giving their unique N of one little bodies what they need to thrive and grow. And it does take a functional look, but my hope again is that even some of the very, very simple things like addressing nutrition just become really standard of care.
Yeah. Well, that's the hope with conversations like these. So I appreciate you coming on and sharing all your wisdom around this condition. And so thank you again for your time.
Well, thank you for having me and good luck with the podcast.
Thank you.